In the name of Allah, the most beneficent and the most merciful. Assalamu alaikum, students. So, the topic of our today's lecture is vitamin D. Today, we will be discussing that what is vitamin D, what is its distribution, from which sources do we get vitamin D, and how is it formed in our body. Okay, and after that, we will be discussing its metabolism, and of course, after this whole discussion, we will have some clinical notes about vitamin D. Okay, so let's start with the introduction of vitamin D. Now, what is vitamin D? It is actually not a single vitamin, rather, it is a group of sterols having hormone like action. What is it? It is a group of sterols having hormone like action. Now, what are hormones? Hormones are chemical messengers generated in our body, of course, and then they travel and have effect on different tissues, either to stimulate them or to inhibit them. So vitamin D has the same function. What will it do? It will mainly participate in the regulation of serum levels of calcium and phosphorus, and it increases the level of calcium, which we will be discussing shortly. And how does it affect? It affects by stimulating gene expression. How does it affects? It affects by stimulating gene expression. It produces its effect by stimulating gene expression, which is similar to that of vitamin A, which may be asked in the MCQs. That the mechanism of action of vitamin D is similar to what? It is similar to vitamin A, and the recommended dietary allowance of 15 mg per day, as mentioned, 15 mg per day to 20 mg per day, i.e. 15 into 10 raised to power minus 6 grams per day. Okay, now we will be discussing its distribution, from which sources we can get what is the distribution of vitamin D in the living world, or from which sources we can get vitamin D. So it has some plant sources and it has some animal sources, but they differ in the chemicals they have. So animals will have vitamin D3 or cholecalciferol, while plants will have vitamin D2 or ergocalciferol. Ergocalciferol is formed from ergosterol, while cholecalciferol is found in fish oil, codfish, liver, and egg yolk. Okay, so the animal sources will be fish oil, fish liver, and these kind of things, while the plant sources are less common and are in the form of ergocalciferol, and it is also formed endogenously. And where it is formed in our dermis. It is formed in the dermis of human beings under the effect of sunlight. And the sunlight that's most appropriate for the synthesis of vitamin D is from approximately 7:30 a.m. to 8:30 a.m. The sunlight, and that time is vitamin D synthesis, and it's of course it has minimum harmful effects, i.e. it has minimum ultraviolet radiations. Okay, now coming towards the metabolism of vitamin D. Metabolism of vitamin D, of course, we will start from the introduction of vitamin D, that vitamin D is a fat soluble vitamin. Of course, if it is a fat soluble vitamin, it will be absorbed in chylomicrons. What will absorb? It will be absorbed in chylomicrons. So, what are chylomicrons? Chylomicrons are actually triglyceride rich lipoproteins which are synthesized in the intestinal cells or the enterocytes. And how are they formed? They are formed from fatty acids and cholesterol. How are they formed? They are formed by fatty acids and cholesterol. So, the metabolism of vitamin D occurs along with the fats. Okay, and how is it absorbed? It is absorbed in chylomicrons. And what are chylomicrons? These are triglyceride rich lipoproteins produced in enterocytes, produced in intestinal cells. Okay, so then after that they will be absorbed in the regional lymphatics. Now the question is, why will be they absorbed in regional lymphatics? Why not blood? Okay, so why not blood? The answer is that they are too large to be absorbed in blood. So they will not be absorbed in blood, rather they will travel through the regional lymphatics and they will go into the liver, taken up by liver, where they will be broken down to get vitamin D. And one important thing is of vitamin D, i.e. vitamin D2 and vitamin D3, these are not the active form of vitamin D. The active form of vitamin D is in our body is calcitriol. What is it? It is calcitriol. In our body, vitamin D, dietary vitamin D, goes through different steps of activation to achieve its activated form, which is calcitriol. And where will it be converted? Mainly in kidney. Okay, so the first step of activation takes place in liver, while the second step of activation takes place in the kidney. Okay, so it will be taken to the liver, broken down into vitamin D, and first activation takes place here. Activation takes place here. And what is the activation reaction? It is hydroxylation. What is it? It is the hydroxylation reaction which takes place with the help which takes place from 25 hydroxylase, and calciferol will be converted into 25 hydroxy cholecalciferol. 25 hydroxy cholecalciferol, and it is the major form of storage and transport in our body. but it is still inactive. So the major form of storage of vitamin D is 25 hydroxy cholecalciferol, and it is also transported in this form, but it is not the active form of vitamin D. Okay, now further it will travel through the blood into the kidney and will be further activated there through by which enzyme 1 alpha hydroxylase. It will be activated through 1 alpha hydroxylase, and this is the second step of activation, and it will take place through 1 alpha hydroxylase, and the product will be named as 1 and 25 hydroxy dihydroxycholecalciferol. 1 and 25 dihydroxycholecalciferol. Okay, so what are the things that are affecting the whole process? Firstly, the activation of vitamin D is not taking place all the time. Rather, it takes place when it is needed. Okay, it takes place when it is needed. It is not taking place all the time. And a stimulus for the activation of vitamin D. The stimulus for the activation of vitamin D is low calcium levels. Low calcium and phosphorus levels will affect, which will produce their effect on parathyroid hormone, which will in turn produce effect and activate one alarm kidney. And through these steps, the cholecalciferol or the 25 hydroxycholecalciferol will undergo its final activation, and it will be converted into calcitriol or 1 and 25 dihydroxycholecalciferol, which is the final activated form of vitamin D in our body, which is actually the hormone which will increase the absorption of calcium and phosphorus in our body. Okay, so now coming towards the effects of activated form of vitamin D or calcitriol, we have learned till now that the first activation takes place in the liver, while the second activation will take place in kidney. So if a patient comes to you and says that I have got a kidney problem or I have got a liver problem, would it be fair to recommend him dietary supplements of vitamin D? No, it won't, because it won't be converted into its activated form, and rather it would cause toxicity. So what you can do is give him calcitriol or the activated form, so it may produce effects, because the inactive or inactive form won't produce the desired effects, rather it will cause toxicity. Now the first thing that should come in your mind in accordance to vitamins, if a kidney patient comes to you, should be that he or she will be deficient in vitamin D, of course, because the activation won't take place, and then when there is no activation of vitamin D, there will be reduced level of calcium, and of course it will also affect the levels of phosphorus. Now what is the stimulus for the activation of vitamin D? We have already learned that a bit low levels of calcium and a bit low levels of phosphorus will cause it will cause the activation of 25 hydroxycholecalciferol to 1 and 25 dihydroxycholecalciferol. Okay, so the conversion takes place in the kidney. It is stimulated by lower levels of calcium and phosphorus, which will produce effects on parathyroid hormone, and thus cholecalciferol will be or calcitriol will be produced. When the calcitriol is produced, it acts as a hormone, stimulates intestine, and it will change its genetic expression. And what will it do? It synthesize more proteins. It will order the enterocytes to synthesize more protein. Which protein? Calbindin, which will appear on the enterocytes as the receptor of calcium and will increase the uptake of calcium. What will it do? It will increase the uptake of calcium. While the uptake of calcium is being increased, it will also produce low levels of calcium will also produce on their effect on bones, which will demineralize the bones and to raise the levels of calcium in our blood. Okay, and once the activated form is produced in sufficient quantities, it will have a negative effect on the inactivated or partially activated form to stop activation. To stop what? To stop the further activation. Now we will come towards the clinical notes or the toxicity. Of course, it is a fat soluble vitamin. It is stored in the body, but it is metabolized slowly. Of course, when it is metabolized slowly, it can cause higher quantities of it will cause toxicity. Okay, and the toxicity is only with supplements, because if the skin is producing more and more vitamin D, more and more cholecalciferol, it won't be converted into its activated form if we have sufficient quantities of calcitriol. Okay, so the only possibility is through supplements, but the upper limit for it is 100 mg per day. If a person takes it for weeks and weeks, then what will be the manifestation of raised level or toxicity of vitamin D? It will be as nausea, constipation, weakness, thirst, and kidney stones, i.e. the calcification of tissues. Of course, vitamin D causes excess level of calcium in blood. When there will be excess level of calcium in blood, of course it will be manifested as calcification. Now coming towards the deficiency of vitamin D. The deficiency of vitamin D may be expressed as rickets, which is a bone disease, or it may be expressed as white or yellow mucus with feces. Okay, so the rickets, now coming towards the rickets may be congenital or nutritional. Nutritional rickets is what you are taking lesser quantities of vitamin D, while the congenital rickets is the one in which a person or a patient won't have enough receptors to catch vitamin D from the dietary sources. Okay, so rickets in children may be nutritional or congenital. So rickets is always in children, and if vitamin D is deficient in adults, it will be called as osteomalcia. What will be it called? Osteomalcia. So the rickets is manifested as incomplete bone mineralization, soft and pliable bones. Of course, bowing of legs, because the legs cannot bear the bones of the legs are not strong enough to bear the weight. Now coming towards the osteomalcia. So the osteomalcia is also manifested as demineralization of bones, and of course when the bones are demineralized, they are weak and they are more susceptible to fractures. And another disease which we call renal osteodystrophy, what will happen is it is a kidney disease. It will, of course, a kidney disease, you should know that there will be lower levels of vitamin D, and when there are lower levels of vitamin D, what will happen is the calcium levels decrease, and what do? So the increased levels of parathyroid hormone will do what? It will lead to demineralization of bone to compensate the decreased value of calcium. And of course the kidney is diseased, so the phosphate level won't be excreted as much it should be, and of course the demineralization is more and the excretion is less, so there will be higher phosphate level. So in a patient of kidney or renal osteodystrophy, what we have to do is to give them activated form of vitamin D and also control the of phosphate. And now we have the hypoparathyroidism. Of course PTH acts to increase calcium levels in blood. When PTH will be decreased, so will be the calcium ions. And so these are the effects which are mainly produced by vitamin D, which we have overviewed. Now once it has produced in our produced effects in our body, it has to be excreted. It has to be excreted to minimize its toxicity. Now how will it be excreted? It is mainly excreted through the bile, of course, in the feces. And Now how is it excreted? It is excreted through the bile, of course, in the feces. And that's all for today. I hope you find this video useful. Stay tuned and subscribe.